some of our virtual attendees are from, we have New Jersey, California, New York, Colorado, Missouri, two people in Canada. One person is in Alberta, Canada, and the other person is in Ontario, I believe, yes. And then there are a few people who are going to benefit from this session in the future because they're going to have a link to our learning channel. So if you missed session 1 or 2, and you may even miss 3, and you're watching this through our learning channel, there will be a workbook. Each of our sessions has a workbook, and the workbook looks like this. It's a PDF. So it is attached somewhere in our learning channel. It will help you follow along. And the presentation is done in mini vignettes, so somewhere between 5 to 11 minutes each of them. And we're hoping that your family will benefit from this and that the information we give you will make caregiving a little easier for you and hopefully more gratifying than you have today. So this is my formal introduction. My name is Stella Nsong, and I am the Elder Care Director for Ohio Elder Care Planning Council. I am popularly known as the Elder Care Cliff Expert. I am the person that helps the USA and Northern America prepare for the Elder Care Cliff. That is the time when the youngest baby boomer will be 85 years old. What we do at the National Care Planning Council and at the state planning councils is we provide this one-stop shopping experience for you. By that I mean a one place where you can come and get everything that you need for your caregiving situation. Information, seminars, resources. We at the Care Planning Council, we hope that through planning, we can make caregiving cost less. We can make caregiving be less stressful. We do know that when we plan, we save time, we save money, we save stress, and we make the process gratifying. Typically, caregiving is that experience that changes lives for many people. Our signature presentation is called One Fall Can Change Everything. Today's session is session number 3, and in today's session, we're going to talk about options for care and then long-term care planning. What do you do when you have this wonderful grandmother in this great home and there are stairs and she cannot get up and down and she wants to age in place and she wants to live in that house? What do we do to help her age in place? We're going to talk about that. But what if you have someone who says, I don't want to go to assisted living, and you know that person could benefit? Well, today we're going to talk about how do you make that decision? How do you start that conversation? How do you know if it's the right conversation? Those are the things we're going to talk about today. Everything comes back to the home. So we're going to begin by talking about the things that the person in the home will need to know about their care options. We're going to start with home health care as option number 1 for caregiving. Now I'm going to introduce Kristen. Kristen, where are you? And Kristen is going to talk to us about home health care being one of the care options.
Home health care are services that are medical that can be provided for patients wherever they call home, whether that be in their home that they're living or in assisted living and independent living facilities. Those medical services which we provide are skilled nursing visits, physical therapy, occupational therapy, and can also be some speech therapy. The goal of home health care in this space is to get a patient safe and independent back into the community. It is a goal to rehabilitate that patient and get them back to their daily lives. So if you're thinking about the one who goes to rehab at a facility and then they still need some therapy coming home, it is an excellent option. Or if they didn't need that intensive therapy at a facility, but they need some therapy going home, it is a fantastic option, again, to get that patient safe and independent back into the community. If they're more aggressive as far as symptomatic and chronic conditions, we have a higher level of care in our palliative program that is just been expanded, and we can look at that as an option as well. When a patient goes from a hospital to skilled nursing facility and then to home, they have the option of home health care, which I referenced, and then palliative is also an option. The role of palliative is to work to manage symptoms of chronic illnesses that we know aren't going to get better. We're talking about COPD, emphysema, those types of illnesses that are chronic and are symptomatic. So for those patients, we can have a nurse practitioner that can come visit them in their home 1 to 3 times per month. It really is a very individualized care plan. They can have the palliative nurse along with home health if they would like. Maybe once home health is finished, they still would like some ongoing care at home. At that point, they could have palliative care. So they're both options for patients. If the patient is even more severe and their prognosis is 6 months or less, considering, they could be eligible for the hospice benefit. That is the highest level of care that we offer at home, and it's the most comprehensive care benefit. In that is included a nurse visit at minimum 1 time per week. Also, the nurse line that's available 24/7. So if there's something going on with their loved one, you can call that nurse line any time of day or night to talk with them. If it's an unmanaged symptom, a new symptom, change in condition, a nurse can come out day or night, it doesn't matter. The goal of that program is really to keep a patient at home. If they're to the point that they're not wanting to go into the hospital, they're not wanting to go into rehab yet again, hospice can be a really tremendous benefit where they can include the medical equipment, medications, and so forth. So we have the 3 levels of care, the lowest being home health to get a patient safe and independent back into the community, palliative, the next level, which you can have standalone or with home health, managing those chronic illnesses, and then the highest level of care at hospice benefit.
Christina, we have questions that come up very frequently about home health care, hospice, and palliative care. The most popular question is, I have insurance, wouldn't it pay for these? Does Medicare pay for home care? Now notice I didn't say home health care, I say home care. So usually when that family is getting home health care, they are expecting that these wonderful home health care people from Heartland are going to come in and do everything. So talk to us about what Medicare does not cover under home health care, how many visits the average patient gets, and what families can expect from the time that they get the referral until the time you discharge them.
A lot of information.
Yes.
Yes, and very, very good questions because it is very misunderstood. So first, to address with home health care, generally speaking, it's at least 6 visits. It may be only 6 visits from the nurse. There are some health plans that are only approving 3 visits from a nurse. So many people think that home health is going to come in and they're going to be there on a daily basis or as needed, and that's just not the case. With home health, the goal really is to have a teachable caregiver in the home and to teach that caregiver how to care for their loved one. Home health is not a primary caregiving option. Again, it's just to support and teach the caregiver that is there to care for that loved one at home. It is for a short, finite amount of time. It just varies depending on insurance, but generally speaking, an average of 6 visits, give or take a few. It just depends. And that goes through Medicare. You could have a copay. Oftentimes, it is also covered at 100%. It really just depends based on all the different plans. And same goes for palliative. With our palliative program, our palliative care specialist would be able to tell you exactly what your out-of-pocket expense would be, if any. And with the hospice benefit, it generally is covered at 100% because you have already paid for that benefit. That answer all of the questions, Stella?
You got it. Thank you.